Good evening, precious friends. You know, we've all been miseducated or blatantly lied to by the medical community. The medical community tells us that carbohydrates don't cause type 2 diabetes, but people who stop eating carbohydrates routinely improve their diabetic conditions and put their disease into remission. Pre-diabetic patients become metabolically normal when they transition off a carbohydrate-rich diet, and people who do not eat carbohydrates at all do not become type 2 diabetics. The medical community tells us fat is what causes type 2 diabetes, but the same patients who go on carbohydrate-restricted diets to put their metabolic disorders into remission still will replace most of that food energy with fat. And still, their metabolic symptoms and their disease gets better or goes into remission. The medical community sees nothing wrong with allowing fat. Doctors with metabolic disorders treat fat patients with metabolic disorders with the same advice and treatments that are doing nothing to improve their own conditions. The medical community tells us that high cholesterol causes heart attacks, but there are plenty of people with low cholesterol who suffer heart attacks, and plenty of people with cholesterol in the 250 milligrams per deciliter range who have no symptoms or any other indications of coronary artery disease. The medical community tells us that statin drugs will help protect us from heart disease and prevent a first heart attack, despite there being no clinical evidence at all that shows that to be true. The medical community tells us that statin drugs are safe and effective and have a low prevalence of side effects, and that they're also associated with dementia, sexual dysfunction, metabolic disorders, and new onset of type 2 diabetes. And your prescribing physician is not required to tell you any of that. The medical community tells us that vegetables are necessary for good health. But a significant number of people, including myself, have severely limited or even stopped completely our intake of vegetable matter and have experienced continuing improved health. The medical community tells us that red meat causes bowel cancer, but there is not one verifiable, documented study of bowel cancer known to be caused by red meat. The medical community will do epidemiological studies and then mathematically adjust the data to make it appear as though they were right all along, even when the raw data clearly indicates the opposite. And this is not considered unethical or even unusual. The medical community considers it ethical to do an observational study and then refuse to publish the data if they're disappointed in the outcome, i.e., it doesn't show what they hoped it would say, and then publicly claim that, well, there's no published data to indicate that they're wrong. Again, this isn't even considered unusual. The medical community requires your GP to give you advice on diet and nutrition, even though they don't require your GP to be trained in human nutrition or even to understand anything about it. The medical community thinks it's just fine for a doctor to diagnose a patient by entering their symptoms into a database and then providing whatever treatment the computer database deems appropriate. This is considered a high quality standard of care. And if the patient doesn't get better, or worse yet, is even injured by mistreatment, the doctor is protected from liability. High quality standard of care. The medical community can fine or censure or otherwise punish a doctor for not providing the treatment protocol indicated by the aforementioned computer database. Even if the patient gets well, the doctor can be found in violation of standards of care, which is a serious enough charge for the doctor to lose their license, even if the patient gets well. The medical community can pressure doctors to prescribe drugs, tests, and surgical procedures to their patients, even if the doctor doesn't believe the drug or the test or the procedure will benefit the patient. The doctor is not required to tell the patient, and sometimes they're even discouraged from telling the patient that they don't believe the treatment will be effective. Trained doctors are quitting in record numbers, no longer treating patients. Stress, burnout, depression, and even suicide among practicing physicians are all increasing in prevalence. It is high time we started looking outside the accepted narrative for the answers to our long-term health concerns. And it's also high time we began to look for a way to allow honest, educated, and experienced doctors to practice medicine for the benefit of their patients rather than for the benefit of the establishment. Now, please don't misunderstand me. There is a lot of good in the American medical establishment. If I'm in a car wreck, or I fall off a roof, or I'm stabbed by a crazy person, I want to be in an American hospital trauma unit. No question. But Americans, a long time ago, made the choice to make medical care a fee-for-service model rather than a public service model. And I understand the reasons why they did that, but when your business model has to rely on the continued existence of sick people in order to make a profit, is it realistic to expect that the eventual outcome would have been significantly different? I don't know what the answer is. I certainly have no idea how to fix it. But what I do know is I can no longer rely on this system for the answers to my long-term health questions. So, I have taken control of my own health. I am choosing what to do with regard to my long-term health decisions. Fortunately, my doctor is on board for now. I am telling her what I want and need from her. But if she's ever not okay with me making the decisions, the next thing that she's going to see is my ass walking out the door. So I encourage you to take back your power, precious friends. You are the boss in the relationship with your doctor. And if your doctor is ever not okay with that, you get another one. I love you all. I bid you peace, love, and meat. And I'll talk to you soon. Bye-bye.